basically strapping on our stethoscopes to do a comprehensive vital signs check on a massive, highly complex organism, the Australian healthcare system. To do this, we're going to evaluate its overall health using the World Health Organization's 6 building blocks. Think of this as a complete top-to-bottom diagnostic workup on one of the most absolutely critical public services in existence.
And right off the bat, the initial lab results look incredibly strong. Just think about this number, 83. Australians currently have a life expectancy of approximately 83 years. That places Australia right up there at the top tier internationally, ranking among the absolute highest in the OECD. Now, this isn't just some lucky demographic quirk, right? It's a direct reflection of really powerful preventative healthcare, strong hospital services, and the crucial safety net of universal health coverage.
Okay, let's dive into this, because a massive achievement like an 83-year life expectancy, that doesn't just happen by accident. We need to transition from the macro success of that long lifespan to the micro mechanics. We need to see exactly how this immense system operates behind the scenes, day in and day out, to keep literally millions of people healthy. To diagnose this system properly, we're going to examine the structural anatomy of our patient across 5 key areas: quality and patient care, the healthcare workforce, digital health and data, financing the hospital system, and finally, leadership and governance. So let's start our first diagnostic check. Section 1, quality and patient care. And remember, we're talking about a system handling 11.8 million annual admissions. Think about the massive contrast in how long a patient actually stays in the hospital. A major quality indicator for any facility is avoiding what we call hospital-acquired complications, or HACs for short. These are things like healthcare-associated infections, pressure injuries, or, falls causing fractures. Now, if a patient avoids these complications, their average hospital stay is just 4.1 days. But if they develop a complication, that stay explodes to 18 days. They are staying 4 to 5 times longer, requiring way more intensive treatment and driving up healthcare costs substantially.
But there is a massive win here for the system's quality control. Australia actually has one of the lowest bloodstream infection rates internationally. So the national benchmark is to have no more than 1 bloodstream infection per 10,000 patient days. Well, Australia is currently beating that with a rate of just 0.74. And a huge reason for this success, the National Hand Hygiene Initiative, which boasts a compliance rate of 86.3%. It turns out simply washing hands effectively is dramatically reducing these preventable infections. It's a game changer.
Well, the diagnosis isn't all positive. When we look at the emergency departments, we really start to see the pain points of the system. We're talking 8.8 million annual ED presentations. And while the median waiting time to be seen is about 18 minutes, the median total stay is nearly 4 hours. In fact, only 53% of ED visits are actually completed within the recommended 4-hour window. If you've ever sat in a crowded waiting room, you have definitely felt this pressure firsthand. This overcrowding is being driven by an aging population, rising rates of chronic diseases, delayed discharges, bed shortages, and of course, ambulance ramping. We see those exact same pressure points in elective surgeries, where over 760,000 procedures are performed annually in public hospitals alone. Looking at the urgency categories, while the national median waiting time is around 49 days, certain procedures like knee and hip replacements can shockingly exceed 250 to 300 days. Plus, there is a serious equity issue here. Potentially preventable hospitalizations are nearly twice as high in remote Australia compared to major cities. So unfortunately, geography still plays a really harsh role in health outcomes.
All right, moving on, we arrive at the absolute heartbeat of the system. Section 2, the healthcare workforce, supported by over 900,000 staff.
But honestly, that heartbeat is under some severe strain right now. The burnout rates across the board are genuinely alarming. National surveys indicate that over 50% of doctors report burnout symptoms, and nurses report emotional exhaustion rates exceeding 60% in certain specialties. So what's driving all this? It's a really grueling combination of forced overtime, constant shift work, heavy documentation burdens, and honestly, distressing rates of physical assaults and verbal abuse, particularly in those overcrowded emergency departments we just talked about.
Now, to protect this vital workforce, policy interventions are actually proving to be highly effective. Several states are now legislating minimum nurse-to-patient ratios. For example, Victoria enforces a strict 1-to-4 ratio on general medical wards and a 1-to-1 ratio in intensive care units. And the evidence is clear. These legislated ratios don't just reduce staff burnout, they directly protect the patient by significantly reducing mortality, falls, and medication errors. It's a win-win.
Okay, let's transition to Section 3, digital health and data. This is really the nervous system of modern healthcare.
But there is a critical vulnerability we have to talk about. The hidden danger of digitizing an entire nation's medical history is that healthcare has literally become Australia's most targeted critical infrastructure sector for cybercrime. Because the data is so comprehensive and so deeply sensitive, the very system designed to keep patients safe medically is under constant, relentless threat digitally. So, to keep hackers out and keep your patient data secure, hospitals have to deploy aggressive defensive measures. They operate under the Privacy Act and strict guidance from the Australian Cybersecurity Centre. This involves heavy encryption, strict clinical access controls, multi-factor authentication, and increasingly, hospitals are actually running simulated ransomware preparedness exercises just to ensure they can survive a direct digital attack.
And they are protecting a massive amount of data. The flagship system, My Health Record, currently covers more than 23 million Australians. It holds everything: medications, allergies, imaging, discharge summaries, the whole shebang. However, major interoperability challenges still remain, mostly because private hospitals, public hospitals, and primary care facilities often use entirely different disconnected software systems. But securing all this data is just one cost in a much larger financial puzzle. Which brings us nicely to Section 4, financing the hospital system. The sector alone accounts for 10 to 11% of the country's entire GDP.
So the crucial point here is understanding who actually foots this massive bill. Breaking it down, the Australian government provides 39.3% of the funding, heavily supporting Medicare, which guarantees free treatment in public hospitals. Then, state and territory governments contribute 30.3%. The rest is made up of out-of-pocket expenses from individuals at 16.3%, private health insurance bringing in 7.8%, and other sources making up the remainder. A really fascinating aspect of this financing is how public hospitals actually get their money. They are largely funded through what's called activity-based funding, or ABF. Instead of just getting a massive blank check every year, hospitals are paid based on the actual number and the complexity of the services they deliver. An independent authority determines the national efficient price for these services. This acts as a powerful mechanism to encourage hospital efficiency without ever sacrificing the quality of patient care.
But, the public system doesn't do it alone. It's heavily supported by the private sector. Approximately 44 to 45% of Australians hold private hospital insurance. This massive private uptake is absolutely vital because it significantly relieves pressure on public hospital wait times, especially for those elective procedures we looked at earlier. On top of this, the Pharmaceutical Benefit Scheme, or PBS, subsidises over 900 essential medicines, which really helps keep out-of-pocket costs manageable for everyday people.
Finally, we arrive at the brain of the whole operation. Section 5, Leadership and Governance, which is built on a highly complex shared governance model.
Basically, accountability is totally baked into the system. Every single hospital must undergo rigorous accreditation against strict national safety and quality health service standards. We're talking everything from infection control protocols to medication safety. Furthermore, the system relies on radical transparency. Through the public My Hospitals platform, anyone, literally anyone, can look up and compare emergency department performance, surgery wait times, and critical safety indicators across the entire country.
Which leaves us with the ultimate question. The Australian hospital system is an undeniable achievement, granting its citizens one of the highest life expectancies in the entire world. But as we've clearly seen today, it is under immense pressure. Between an aging population, a rising chronic disease burden, critical workforce shortages, and the exploding costs of advanced technologies, maintaining this level of universal healthcare while controlling expenditure is the definitive challenge of our time. Can this massive, brilliant machine remain financially sustainable in the decades to come? Honestly, it's the multi-billion-dollar question we all need to be thinking about. Thanks so much for joining me on this explainer, and keep questioning the data.